Hello, sir. You recently treated a child for a root canal treatment who was actually treated under general anesthesia. Why did you feel the need to get a treatment done again?
So this little one who was treated at the age of 2 years, they were recommended to put crowns on the back teeth as well, which at that point in time the parents gave a hard thought and decided against it. So what happens is if the tooth is not covered completely and you're not able to take care of the risk factors, which involves your brushing 2 times through the day using a mouth rinse, uh, regular follow-ups and flossing between the two teeth. So if this goes amiss, what happens is this little one, when she came in for her follow-up and we took a radiographic follow-up for her, you'd be surprised that there was a huge cavity which was very close to the nerve. So what we had to do was then manage the little one under oral sedation. We gave her the syrup, put her under laughing gas, and then eventually I had to do root canal for one tooth. And for the other tooth, we did it in a minimally invasive manner and just did something called as a Hall's crown. So the Hall's crown is basically covering the tooth completely, which prevents any further attacks of your daily eatery insults that happen on these teeth. And we could avoid the root canal for that one tooth, but the other one was not spared.
So, could this have been avoided?
Yes, of course. So, parents have to understand that when we are putting the child to sleep in a hospital setup, the treatment plan is always going to be aggressive and probably one step ahead. Aggressive in the sense that now the tooth that needed a root canal right now was actually filled under general anesthesia. But then the child landed up with cavities between two teeth, which are very notorious. Cavities between two teeth are visible only on your radiographs if the surfaces is not broken or you don't see a frank hole from the top. So these are cavities which usually go undiagnosed most of the time. And by the time if the child comes to you and you see a cavity between two teeth and it's already broken down, then please be rest assured that the cavity has already approached the nerve. So at that point in time, had we filled but gone one step ahead and covered those teeth, then probably we would have avoided all the root canals and entire rigmarole of injecting, putting the child through that oral sedation visit, and everything would have been taken care of under general anesthesia itself. But what happens is sometimes the cost comes as a hindrance, but parents have to understand that this is an investment for the next 8 or 10 years for your little one. So that little one who was treated at the age of 2, and had they covered that tooth with a crown, we would not have to spend more and we would not have to give that efforts and time again chair side for that little one. And trust me, if the tooth was covered under general anesthesia at the age of 2, I can guarantee that for the next 10 years I would not have to do anything for that specific tooth.
So, it is your recommendation that the crowns must be placed on the tooth once it's treated.
So ideally, if the child was treated chair side, then of course we would have just avoided the crown. But since the child was treated under general anesthesia, it was always, see, I cannot put the child to sleep again and again. So if the child is put to sleep once, then you might as well put in those extra 3 minutes and just cover those teeth with crowns, is what is strongly recommended, not by me, but there are guidelines which are set by the American Academy of Pediatric Dentistry that it's better that a full coverage is placed rather than doing restorations and avoid repetitive work in these children.
Is that what is practiced here? And are there any cases which has shown that better results?
Correct. So, if you see most of our cases, we've treated around 14 teeth out of 20 teeth under general anesthesia. In some children, we've all gone full blown, 20 out of 20 teeth that require treatment. And if you see the follow-up photographs of of these children, you will see that almost all their back teeth are always crowned, including the corner tooth, because the corner tooth is the last one to fall in this child's mouth. These teeth usually fall by the age of 13 years in the upper arch.
So, sir, once the crown is placed on the tooth, are there any precautions or uh, care that must be taken by the parents or the child himself or herself?
So if you ask me, nothing specific that needs to be done. In fact, if you don't brush the crown teeth also, it's okay. But that's not an advice that we would like to give. You have to follow the home hygiene protocol diligently because these crowns are meant to shine. And if you see a dull layer, that means there is buildup of plaque on these surfaces as well, which may cause bleeding gums later on. So it's important that you keep these teeth shiny. You make sure that you're brushing twice. You also make sure that you're flossing contact areas. Suppose there's a crown and there's a natural tooth which has not been crowned. You still have a chance of catching cavities between these two teeth here. So you make sure teeth which have been spared and not been crowned, those areas which have tight contacts, you need to floss those areas as well. More importantly, after treating the child under general anesthesia, what we have seen is that parents don't end up coming back for their follow-ups. So we have to make sure that we see these children every 4 months or at least 3 times a year post their treatment under general anesthesia.
And so, does this crowning or getting this whole rehab help them in maintenance of the permanent tooth, or are there any positive results on the permanent teeth as well?
Correct. So first thing first is that since nothing is going to happen under the crown, be rest assured there's not going to be any need for any root canals for these teeth. Second is, if you have established good contacts between the crowns, what happens is whenever the child lands up with a cavity between two teeth, you end up losing space. And any loss of space at this point in time will show its repercussions later on when the permanents want to come out. But if the tooth is crowned, the space required for these permanent is already being taken care of. So these crowns are basically placed on teeth which are going to fall off naturally. They are placed on those surfaces itself. So just consider this as a natural tooth, just that the color may be metallic or it may be white. But these teeth, be rest assured, will fall off on their own like a natural milk tooth. So there are instances wherein sometimes even a natural tooth does not fall off. That's the time you may feel the need to visit the pediatric dentist to get them removed. But that's a pretty rare phenomenon in these children.
Thank you, sir, for this enlightening talk.